Hi, everyone. It is Congressman Jamie Raskin coming at you from Maryland's beautiful 8th Congressional District. It's my favorite time of the week, local hero, and we get to celebrate the people who make life here so special and so wonderful, even through the various crises of the day. And I want to wish everybody a happy Veterans Day. A special salute, of course, to our veterans who have served us so well. Our local hero today is a veteran, Dr. Cynthia Izuno Macri, who served for 35 years in the U.S. Navy as a gynecologic oncologist in a variety of different academic and leadership posts at the National Naval Medical Center, the Naval Hospital in Jacksonville, Walter Reed Army Medical Center, and the Uniformed Services University right here in Montgomery County before going to the Pentagon to become the special assistant to the chief for naval operations. So in retirement, she has only gotten more active and engaged, working on everything from homelessness to veterans and women's health, substance abuse, mental and emotional health, suicide prevention, and she continues to play soccer too. But she's been a commissioner for the Maryland Governor's Commission on Suicide Prevention and the Maryland State Veterans Commission, but also right here in Montgomery County, our Commission on Veteran Affairs. She continues to be a widely published author. She's written multiple scientific papers and book chapters, and she has been recognized all over the place for her innovative outreach programs to young people in middle school and high school to help them to stabilize their own emotional and mental health and to be safe and prosperous, and also to learn to pursue careers in medicine and science and technology. So Dr. Macri lives in Kensington. Congratulations, Cynthia, on being our local hero for this week.
Thank you, sir.
We're delighted to have you. So look, let's talk about some of the different things you've been involved with. And why don't we start with the question, which is of course close to my heart, about suicide prevention. Tell us some of the things you've been working on with the commission and some of the special outreach programs you've been focused on.
Right. So the Montgomery County commissions that are a coalition in this case that I work with has been extremely active. We have looked at a number of different areas, including breaking it down into youth, adult, like the workforce, right? Because right now we're stressed as in the working age group, and then seniors, right? Seniors are suffering from social isolation, maybe not being able to socialize in the usual ways that they have. Maybe they haven't been able to see their grandchildren, et cetera, et cetera. But the middle group, which is the working age group, they've suffered from an entirely different thing. And that's why it's really important to look at what stressors are. It's not a one size fits all solution. And the Montgomery County Coalition has looked at that as well. The Governor's Commission has focused on gun safety as well as data, collecting data. And we have talked a little bit about disaggregating the data so that the results or what we recommend would be more relevant to certain at-risk groups. So again, the Veterans Commission are on suicide prevention, or the Veterans Advisory Committee on Suicide Prevention has actually looked at gun safety as an issue. Are a little bit more, we're trained to use guns in a way that and be successful with them in ways that civilians may not be. So so again, we're looking at a lot of different areas in Montgomery County. We're also looking at postvention.
Yeah, and I know that both in your state and your county work, you've also addressed the problem of veterans' homelessness.
Yes,
that's something else that you've worked on. Are we making progress there? Do you feel like we're moving forward?
Well, so veterans actually have a what we call functional homelessness rate, essentially a 0. And we do have a lot of new things for services for veterans. And one of the things, as you mentioned earlier, is mental health. And, recently opened a Stephen A. Cohen clinic for veterans, which is under Easter Seals in Silver Spring. So it's in the Silver Spring area, which sometimes is harder to access care for individuals. We have Every Mind up in Rockville area. That offer these services that are relatively comprehensive, include many things. Because as you know, just because somebody is homeless, let's say, that may not be their most important issue, right? We think it is because we have a home, we live someplace. But for somebody who's homeless, that might not be their most important. And if we listen, which these organizations are trained to do, if we listen to people, then maybe we can find out what's important to them. And then another place that I volunteer is up in Baltimore. It's the Maryland Center for Education and Training, for Veteran Education and Training, and it's run. CEO is a retired Air Force guy, and it is a transitional housing facility for veterans. And anybody can go there. Who qualifies can seek to be stably housed in a transitional setting, and receive, get their veteran paperwork in order, have mental health counseling if they need it, even job training. There's been a couple of local groups that have helped out. I spoke specifically to somebody from Clark Construction, another Montgomery County business, that said, yeah, you don't need a security clearance to work construction. They have some projects up in Baltimore. Maybe we can get some of the veterans to work in there. So it's very complex, but again, if we get out of our silos, right, and start collaborating, maybe we can find some easier solutions, right?
Well, look, Cynthia, I just want to say you spent 3.5 decades as a practicing doctor, right, as an oncologist in the Navy. You retired, and instead of going off and just playing bingo or shuffleboard or something, thrown yourself into the community. It's the most amazing thing. And I know because you serve on my Service Academy nomination panel, and you are such a diligent member in terms of going through all the applications and everything. And so I wonder if you would just say a word before we close generally about what it means to be in this phase in life, and how you decided to be as busy as you ever were, but in a bunch of different endeavors.
Well, okay. So first of all, being a military doctor is the best job on earth. Just in case anybody had any doubt, it offers you being in the military offers you way more experiences, opportunities that you don't even think about, because you can't even imagine what they are, right? So I was a surgeon, I taught residents, I did research, all this cool stuff, right? But when I got out, I was like, wait, why isn't everyone more healthy when I've been telling them, to eat better and exercise more, right? For 40 years. So I started working on more of the prevention side. And what I really think is probably the critical thing, right, that I've learned from evidence-based programming, right, is as veterans, I love my 10% discount at Home Depot, and I can't possibly eat all the free meals I'm going to get on today, right, on this day or Memorial Day, whatever. But we have a lot of inner strength, right? So why, as a medical professional or as healthcare provider, why don't I give that strength back to the patient? I'm going to re-empower the patient to take control of their own life, right, of their own health. I'm only with them for like 30 minutes, right?
Yeah.
The other 23.5 hours of the day, they're taking care of their own health problems, whether they do nothing or they work against themselves or they get out and walk more, Either way, Montgomery County is a healthy community, except for, no sidewalks in our neighborhood, but it's a healthy community and everybody's out there. We did a veterans program at the Ottawa Natural Society, the Wood End campus. It was so serene. And yet, if you listened hard, you could actually hear the traffic of the Beltway,
Right.
But, we have all these parks, we can be more healthy. But as a provider, I want to give that back to the patient and re-empower them to take that control for their lives, instead of just writing them a script, giving them a pill, or telling them what to do, right?
Right.
So,
Well,
anyway,
look,
that's why.
it's such a joy to be able to recognize you for everything that you do in Kensington, in Montgomery County, in the state of Maryland, for veterans, for young people. It's just remarkable. And thank you for showing us the way to retire and to be busier than ever. So we're very grateful to you. And for all these reasons, Dr. Cynthia Macri, you are our local hero this week. Thanks so much.